A high-risk pregnancy is one that involves complications that could put the mother or baby at risk. There are a number of different factors that can contribute to a high-risk pregnancy. Many high-risk pregnancies can be successfully managed with lifestyle changes and close monitoring by a healthcare team. However, in some cases, more aggressive treatment may be necessary to ensure the health of both mother and child. Regardless of the individual circumstances, all high-risk pregnancies should be closely monitored by a qualified healthcare provider. List of high-risk pregnancy conditions. A high-risk pregnancy is one that threatens the health or life of the mother or her baby. Many factors can contribute, including: Number 1. Obesity. Number 2. High blood pressure. Number 3. Diabetes. Number 4. A history of previous miscarriages. Number 5. Women who are over the age of 35. Number 6. Women who are under the age of 17. Number 7. Women who have a family history of genetic disorders are also at an increased risk. Number 8. Women who are pregnant with multiple babies, twins. In some cases, complications develop during pregnancy that put the mother and baby at risk. These can include: Number 9. Placenta previa. Number 10. Preeclampsia. While every pregnancy has some element of risk, high-risk pregnancies require close monitoring by a team of healthcare professionals to ensure the best possible outcome for mother and child. What age is considered high-risk pregnancy? Pregnancy is a beautiful but also a high-risk time for many women. One of the things that can increase the risk for problems during pregnancy is the age of the mother-to-be. For example, women under the age of 17 or over the age of 35 are considered to be at a higher risk for complications during pregnancy. This is because the younger the mother is, under the age of 17, the less developed her reproductive system is. Older mothers, over the age of 35, are more likely to have chronic health conditions that can complicate pregnancy. That being said, every woman's body is different and there are many healthy pregnancies in women of all ages. The best way to ensure a healthy pregnancy is to consult with a doctor and receive regular prenatal care. How many ultrasounds during a high-risk pregnancy? How many ultrasounds during high-risk pregnancy is a common question that obstetricians are asked. The answer, like with most things in life, is it depends. If a pregnant woman has a history of preterm labor, placental abruption, or twins, then her obstetrician may order more ultrasounds. In general, though, most obstetricians order 2 to 4 ultrasounds during pregnancy. The first ultrasound is typically done around 8 weeks to confirm the due date and to look for any major structural abnormalities. The second ultrasound is done around 20 weeks to check for things like gestational diabetes and static encephalopathy. The third and fourth ultrasounds are typically done around 32 and 36 weeks respectively and are primarily used to check the baby's growth. Is gestational diabetes high-risk pregnancy? Gestational diabetes is a type of diabetes that is first diagnosed during pregnancy. The condition usually develops during the second or third trimester, and it can cause serious health complications for both mother and child. While gestational diabetes is treatable, it does increase the risk of high blood pressure, preeclampsia, and premature delivery. In severe cases, it can also lead to stillbirth. For these reasons, gestational diabetes is considered a high-risk pregnancy. If you are pregnant and have been diagnosed with gestational diabetes, it is important to monitor your blood sugar levels carefully and to follow your doctor's treatment plan. With appropriate care, you can minimize the risks associated with this condition and give your baby a healthy start in life. How much folic acid is for a high-risk pregnancy? Folic acid is a water-soluble vitamin that is found in leafy green vegetables, legumes, nuts, and fortified foods. It is important for the development of the neural tube and can help to prevent certain birth defects of the brain and spine. For women who are at high risk for having a baby with a neural tube defect, the American College of Obstetricians and Gynecologists, ACOG, recommends taking a daily supplement of 4 micrograms, mcg, of folic acid. This is in addition to eating a diet that is rich in folate-containing foods. Some women may need to take a higher dose of folic acid if they have certain medical conditions or are taking certain medications. Talk to your doctor about how much folic acid you need to take to reduce your risk of having a baby with a neural tube defect.